Hello, everyone. Welcome to the Pharmacy IR podcast, and my name is Devin Olden. And today we're reporting from the Drug Information Center, where we bring you unique pharmacy careers. And today we have a very special guest who goes by the name of Dr. Kim Kelly. How you doing today, Dr. Kelly?
Doing well, Devin. How are you doing?
I can't complain. Can't complain. Well, let's go right into it, okay?
That sounds great.
Coolio, coolio. So, first question: who is Dr. Kim Kelly, personally and professionally?
All right. So I'm Kim. So start there, right?
Cool.
So I'm Kim. And personally, I'm a mom of two young kids. I have a 9-year-old, almost 9-year-old, and a 6-year-old that's in kindergarten and thinks she's 16. And up until recently, I was actually working right here at Campbell University. And now professionally, I'm a pharmacist. I graduated from UNC back in a long time ago. We're not going to talk about that. And did my residency at Moses Cone in Greensboro, and then worked at several hospitals in the Raleigh area. Worked at Moses Cone, obviously, during my residency. Went to Wake Med, worked there for 3 to 4 years, and then transitioned over to being internal medicine faculty member at Harnett Health right down the street from here, and faculty member here. So then after about 8 years or so, started the residency program over there, and after about 8 years or so, decided it was time for a change, and now I'm a medical science liaison for a small vaccine company called VBI Vaccines.
Nice.
So, yeah.
Nice. Sound like you're a wealth of knowledge.
Well, I'm not sure how wealth of knowledge, but I've done a bunch of different things, which is kind of fun. And that's what makes pharmacy so exciting, because you don't have to stay in the same path the entire time of your career. Once you feel like it's time to do something different, you can. You can just make that change.
Gotcha. And you said that your title is a medical science liaison?
Yeah, so technically my title is senior medical science liaison, right? But yeah, so medical science liaison is what I do. So do you know anything about that position?
I wish I did. Could you explain that to me, please?
Yeah,
what are your responsibilities and what does your day-to-day look like? So a two-parter.
Yeah, so my responsibilities. So medical science liaisons are kind of a new-ish role within pharmacy. And you can see MSLs, which is kind of what we call medical science liaisons, from all walks of life. You can have, there are MDs that are on my team, there are PhDs that are on my team, there are PharmDs. Sometimes you can even see nurse practitioners and different areas. The idea is what you're trying to do is, from a drug company perspective, is liaise with physicians or other key opinion leaders and talk about what's going on medically with the newest data with your drugs. And so talk about, so I represent a hepatitis B vaccine. So it's, why is our vaccine potentially different than the other vaccines that are on the market? What does our data look like? And then one of the other things is sales folks can only talk about things that are on label. Gotcha. Medical science liaisons can talk about anything off-label. So if someone has a question out in the field, that's an off-label question, I'm allowed to answer that. And so sometimes they'll bring me in or call me if they're talking with one of their salespeople, and then I can answer an off-label question that they're not allowed to answer. So I'm able to have that type of rapport. Some of the other things that we talk about are we will, like, let's say you were a physician and you were really interested in using our drug on a new study that you were saying, hey, I want to check it out in my specific patient population, which I feel is an unmet need for your specific drug. I'd be like, cool, there is what we call sometimes IITs, or investigator-initiated trials or studies, and I would liaise with you and figure out, what kind of study do you want? Does it meet with our goals? And how can we best support you? Can I give you free drug? Can we give you, however much money you need as like a grant or things like that? Gotcha. So we do a lot of those types of things. So because we do a bunch of different things, my day-to-day isn't the same, which is great for me. Right, gotcha. Because I don't like doing the same thing every day. So I like doing different things every day. And so one day I could be, so a couple weeks ago, I was in Pensacola one day, and then the next day I was in Jacksonville, and then the next day I was in Atlanta, and I was there for 2 days, and then I came home. And then I went down to Fayetteville for a day trip. So like that was my Monday through Friday, and it was crazy.
So you went to all of these different places within a week?
Right. Yeah. So I flew to Pensacola Sunday night. I was there for one night. I flew out that night from Pensacola to Jacksonville. I was there for one night.
Gotcha.
I flew out from Jacksonville to Atlanta. I was there for 2 nights. That was really nice.
Okay, it's better.
Right.
It's better.
And then I got to go home. But I was talking to a bunch of different people about our vaccine and getting their opinions on our vaccine and supporting my market access people as well as my sales folks.
So let's say a recent graduate who just got their PharmD, and let's say they, not including like residents or anything, about how many years of experience would they need to do what you do?
Yeah, so it definitely depends on the person and it depends on the company, right?
Gotcha.
Oftentimes the companies want you to have clinical experience in the area in which you are supporting their product. So
Gotcha.
let's say it's an oncology product, they want you to have oncology experience out in the field because I'm talking to oncologists, right? So I need to have some expertise in that area so then I can better talk to those folks, right?
Gotcha.
And they know that.
Credibility.
Exactly, credibility.
Yeah.
I need some street cred.
Little
And right. And so if I don't have street cred, they're not going to listen to me. And I'm also not going to necessarily feel comfortable talking to them, right? Because
Yeah.
I'm like, what can I tell them? They're the expert, right?
Yeah.
So they want experience. They also want someone that's good at talking to people, good at
Talk about that a little bit.
right,
Please.
right. So
because we really don't learn, well, at least through my experience, I think I've learned more communication skills just through life and just working
100%.
as compared to like sitting in the classroom, like the day-to-day didactic portion.
100%. So, and there are certain things that just can't be taught, right? Like, no, there are some times that I have meetings that I haven't actually talked to people about my drug or their product. I've asked them about their kids. We have kids that are same age. Like I ended up I was like, give me 30 minutes of your time. We'll talk about this. And an hour and a half later, we had found out that our daughters were the same age. Her daughter was running around the yard, like refusing to put on pants, and I was like, oh my gosh, mine's crazy too, So like, exactly. So like having that rapport with people and just be able, I can pretty much talk to a wall if I am bored enough. So, right. So like just talking to people and getting to know them on a personal level is really important because once they trust you from a personal perspective, they'll trust you with what you're saying from a medical perspective, right? So
Definitely.
If you go and you talk to somebody and you just go in and you're like, I am here to tell you about the data. Here is my data. Ask me, do you have any questions?
Mm-hmm.
No? All right. Well, it was nice talking to you. I am going to walk away. Like
the wall is still up.
Right. Like who wants to talk to you beyond that? Like the goal is that we're going to form these relationships and you're going to want to talk to me again month after month and year after year because I'm going to be the person that has the new information about the product that you're using that I can talk to you about, right?
Oh,
like
so there's a follow-up.
Oh, yeah.
Okay, gotcha.
So like the idea is that I'm going to form these relationships. If they have a question about this product, they can just pick up the phone and call me and say, hey, this happened in my patient. Has this been reported? Is this normal? Right. What do you know about this? Or I hear that there's this new thing or you're in the news. What's going on with that? Like, what do you know about this? And I can have that conversation on a peer-to-peer level, not from a sales perspective, because my goal isn't to sell, right? There's nothing about which is great because I'm not a salesperson, right? Like if someone ever came up to me and they were like, what do you think about this drug? And I'd be like, okay, really? So this isn't the best data, but this is the data that we have, right? Like, so, and I'll start with that, right? Like you wanted to know what this data is. Here's the data that I have. I understand the N is small. I understand that it's not statistically significant, but this is what I have for you. And they're like, got it. I appreciate that.
Gotcha. Sounds like you do a lot.
And being a straight shooter
like
is fun. Yeah.
And, I mean, I'm sure they appreciate that. Just trying to be as objective as possible, but just knowing that this person is trying to look out for my practice or trying to look out for my patients as well, and not just trying to, like what you said, I'm not trying to sell you anything. I'm trying
Right.
to inform you so you can make the best decision.
Exactly. I'm trying to be here to give you so you can make the most informed decision about your patient.
Yeah,
The goal behind this is like, well, then why would a company pay for this person, right? Like,
that's the next question. Yeah.
right, like I'm not trying to sell you anything. I'm not trying, so what am I doing? And the idea is that I go out and say, "Hey, what do you think about this?" And they're like, "Well, you don't have data in this area.
Right.
And I treat patients that have this condition. And because you don't have data in that, I don't feel comfortable giving it to my patients with this condition because I don't know how it's going to work. But your competitor, I know how it's going to work with them."
Gotcha.
So then I say, "Hey, guys, you people back there, this is a gap and this is a knowledge gap and we need to fill that."
Gotcha.
So we are bringing the information to the physicians, but the physicians are also providing us information of what they need. And then I can bring that back to the company and say, here's what they need to better use your product in this specific patient population. And then that potentially starts like those IIT discussions, right?
Right.
So cool, I understand this. Do you want to use this product? And, I wouldn't specifically ask them that because that's not investigator initiated, but they could say, I have this, I see that this is unmet need, or do they want to do a phase 4 study, or do they want to do different data sets from this? Yeah.
This brings me to my next question of what are some of the challenges of your day to day? Because to the average person, they're thinking, man, if I'm making X amount of dollars and I get to travel from here to here, and it sounds great, but what are some challenges that come along with this position? What challenges and also like benefits of your job?
Sure. So if you're
career, excuse me.
Yeah, it's both, right? So some challenges are we have to meet with physicians. How busy do we think physicians are? How hard is it to get 15, 20, 30 minutes of their time?
Yeah.
So at times it can feel daunting to continually reach out to physicians and either get ghosted, or hear no, or set up a Zoom meeting and I'm like, here we go, we're going to have a great conversation today. And then they ghost me, So having those types of things are difficult.
So are you usually the one to schedule these appointments or these meetings, or is there a middle person, or do you have someone do that for you?
So that's great. It's both. So I will schedule appointments with people that I have identified that might be interested to hear about our products. But then oftentimes my salespeople will call with questions, or my market access people that are trying to get us into larger facilities, they will call and set up appointments for me to go in and educate like a group of people and be able to answer questions more thoroughly than they would be able to. So the answer is yes.
Coolio. So you mentioned earlier that you were with the institution right now at Campbell.
Yeah.
And what do you think was the biggest, let's talk about the transition. Was it an easy transition from academia to, but of course you were practicing as well.
Yeah.
But academia and practicing to what you do currently, the medical liaison.
Yeah. So it's definitely a change, right? Like it's going from, I'm not pulled in 17 different directions like I was before, right? Because I was an RPD, I was a internal medicine specialist, and I was a professor.
Yeah.
And I was going in 3-4 different places at once. But like I said, I like doing something different every day, which is what this was, right? For 8 years, I was doing something different every day. No day was the same, which is the same as what's going on now. So that's a good change. It's difficult moving from an environment where I didn't realize how extroverted I probably am until I was sitting at home, like in front of my computer, sending emails to folks.
Right.
And so I would show up at the old hospital some and things like that because I was craving some personal people to talk to and
Yeah.
and bother. So so I would go bother some people,
I
and
mean,
it
I
was
knew you were very
fine.
outgoing from whenever you taught us in class. Like, you were very open, and you did want the class to get very like to like talk, like ask me a question, like get very involved, and that was something I definitely appreciated, like from
I
classes.
appreciate that.
That outsider, like that rogue person, to say, all right, we need to shake this thing up, and we need to do something different, and I want y'all to learn something. So talk. So I do appreciate that.
And I appreciate saying that. I hate being boring. And so
Oh, that's an episode in itself. Yeah,
right, like I don't
yeah.
want to be boring. I don't want to be bored. So like that's some of the things when I'm having these conversations with people. Some of some people can say, well, I give the presentation. I'm like, I mean I give the presentation and then I stop and I ask questions and
Yeah,
I try not to be boring is really, and that's part of what students would need to know, right? Like
right.
you can't just stand up there to a physician and be like, here's my, especially if I have 15 minutes, right? Like
Straight to the
if
point.
I have 15 minutes, I gotta get straight to the point. Here's what
Yeah,
I need to tell you. Do
yeah.
you have any questions? All right, bye.
Gotcha.
Right? Because like that's all I have time for. So, but I need to be engaging in that 15 minutes and not
Mhm.
zone out. Um, there's some new fellowships now too for students that can go into like medical affairs fellowships
Gotcha.
for people that are interested in this type of role. I'm old and they didn't have things like that when I was uh, coming through pharmacy school, but yeah,
So that would be the fellowship that's looking more like 2 to 3 years, possibly.
I think they have a 1 year
1 year.
and a 2 year fellowship, but there's also 1 year.
Can't beat
Yeah.
that. It's probably super competitive, which I would expect, but
Yeah, one of my coworkers actually did the GSK medical information fellowship that was just 1 year, and then he went straight into an MSLing job.
nice.
Yeah.
So that leads me into my next question of what type of students do you think would be interested in this type of role that you do?
Yeah, so I definitely think it takes a certain type of person that is okay with stepping outside of their comfort zone and talking to people that they don't know.
Mm,
Right? Like
yeah,
if you don't feel comfortable walking up to someone that you don't know
right.
and just talking to them for a good 10, 15 minutes or trying to get to someone to
Right.
make sure that you're talking to them. If you feel uncomfortable in that, this probably isn't the role for you.
Gotcha.
But you have to know your stuff. You have to know your data, know your statistics,
Mm.
know your drug information resources from Dr. Perkins. So, and
Or probably someone who's a bit more conservative. This probably wouldn't be the best position. You
conservative
think?
how?
Conservative is in. I like my day to day between 9 to 5, Monday through Friday.
Right.
I like to know where I'm at every single day. All that great stuff.
Right.
Like that probably wouldn't be the
Yeah.
best one.
If you like your plans,
Yeah.
like this is not the job for you either, because there are days that I left my house at, gosh, I did a day trip to Atlanta 2 weeks ago. I was on the 5:30 a.m. flight and I was on the 3:30 p.m. flight home. So like I was up at 3 a.m. and I wasn't home until about 5:45, 6
Mm.
p.m. So
Did you know about this
it was a
before you
long
signed up
day.
for the position?
I mean, and to be honest, I'm choosing to go and do a day trip. My
Gotcha.
company would pay if I went down the night before, stayed at a hotel, things like that. That's not
Mm.
it. It's I have 2 kids. And so
Yeah, I
I
got
can be
family.
at home and have dinner with them Thursday night and then but if I was flying out, I would have been at the airport. I would have missed dinner
Yeah.
with them. I would have missed bedtime with them. And so I can I'll wake up at really early o'clock and it's okay
Early class.
because
Yeah.
I can still get home and I saw him for bedtime the next night.
Mm.
So one of the other things is like I can determine a lot of my schedule.
Gotcha.
So like
'Cause I was going to ask you about the work-life balance. I
Yeah.
went straight there. Yeah.
yeah, I can determine a lot of it. If I know that I have a dentist appointment or I have a kid's appointment or my kid is doing something at school, I can just not schedule a meeting on that Thursday, right?
Right.
Or on
Yeah.
that Friday or whatever day it is. It's a little bit more difficult when you're going based on like when sales where market access is requesting that you be somewhere.
Right. Is it certain times of the year, whenever that happens, or?
It ebbs and flows, but there's not really a time of the year. But there's definitely just, I can just say, like, I'm here at 2:00, right? I just, one of my folks had asked me last week that we needed to have a meeting. We have a meeting tomorrow with a client, and he said, "Oh, well, let's get together either Monday or Tuesday of next week." And I said, "Well, Tuesday I have something, so that's not going to work out well for me. So we can do it on Monday." And he was like, "Okay, cool." So like, that's it. I can work my schedule for the most part around a lot of different things, which is nice. Now, there are the times where if your territory is larger, you might have to be doing these day trips to Tampa, Georgia, wherever, or you go to conferences and you support these conferences, and those are 4 or 5 days at a time.
But for the most part,
I can do some day trips. I can do a lot of, things like that. But yeah.
Got you. So on the road to where you're at now, to being very successful, I'm assuming that there were mentors on the way there. And my question is, did you pick these mentors, or was it more of a natural chemistry? This person like that person like this, and we just found a commonality. We worked towards it. Like, did you go and find them, or was it more of a natural?
I think
We
it's more
found
of
each
a
other.
natural finding of each other
Gotcha.
and being like, you understand me, I understand you.
Yeah.
And to be honest, sometimes it was my personal colleague. So not necessarily someone that had been there before, but someone that I actually worked with at Campbell, that we were close together and we kind of like pushed each other into certain roles. What are you doing here? What are you doing there? How are you moving throughout your career? What is the next step that you see for yourself? And like really bouncing ideas off of each other.
Gotcha.
And then saying, okay, how can we achieve that? What are the things that we can do next?
Gotcha. So it's been more of a peer-to-peer relationship.
More of a peer-to-peer relationship.
Okay,
Yeah.
Gotcha.
Yeah.
And for if you had any advice for students that are trying to be the next Dr. Kim Kelly, what would you give
Lord. Run away. Don't be me.
them?
No. I think no. I have loved the choices that I have made, and I have loved every path of my career. I think it's the things I always told my residents. I'm going to tell everybody that now too. Number 1, your first job is not your dream job. It doesn't have to be your dream job. So stop trying to find your dream job as your first job.
But I work so hard.
Get a job. Get a job first.
Get in the game.
And we can find your dream job afterwards.
Gotcha.
Right? Gotcha. So that's your first thing. And then the next thing is keep your options open. Just because you feel like this is where you always saw yourself,
right,
doesn't mean that plans can't change. So keep your mind open to flexibility. If you said, I always wanted to own my own independent, well, and you try it and you're like, this is not what I thought.
Right.
You don't have to be stuck there for 25 years. Sell it. Do something different.
Right.
Like I always saw myself in a large academic medical center working in the critical care unit.
Right.
I kind of did that for several years at Wake Med. I was like, okay, I feel good now. What's next? And so if you start getting that itch, find out what's next. What's next in your path, and what's going to make you happy, or what's going to make you fulfilled and still challenged. I think oftentimes people get complacent in what they're doing and they don't find that next challenge. And if you can't find that next challenge at the place that you're currently at, find it elsewhere.
Right.
Change. Make the change. Don't stay complacent where you're at.
You could probably look around to your peers too. And never to compare yourself, but just to see what's next. Because if I see my peers are growing in other places, it's like maybe there is more I could do.
Right.
Not in a competitive way, but more of in a I'm trying to grow as well, and I'm not satisfied just being where I'm at.
Right.
I can do more.
And I'm not saying if you're the person that wants the challenge continually, right? One of my best friends who works at CVS, that was super smart. She had a 4.0 at UNC, like had a crazy NAPLAC score. She's one of the smartest people I know. And she's been working at she's been working at CVS since we graduated. She's amazing. She's amazing at what she does. She's amazing as a retail pharmacist, and she's happy at
Okay, I was about to
CVS.
ask that.
And
Yeah.
so she's happy doing what she's doing, and that's fine. She doesn't want to do anything else.
Gotcha.
Yeah, and that's great. If that's you,
Yeah.
that's
As
fine.
long as you're satisfied.
Right, as long as
Yeah.
you're happy. But the second that you start being like, huh, or that you start thinking, I mean, it's fine.
It was cool.
It's a job. It's fine. I get paid. I do that. Start trying to find that fire again, because that's not, you should have a passion. You should have a love for what you're doing. You should want to get up every day and do it. And when that's not what's happening every day, then it's time to start thinking.
Yeah,
and I know applying for jobs is not the most fun. I get it, but still.
Yeah, because it's super draining as well. Whenever you just look forward to Friday or just look forward to the weekends.
Right.
And then that's whenever I realize like I'll either stop putting more effort into like what I'm doing, something I was super excited about at the beginning. Then all of a sudden, I'm looking forward to Friday. Now everything is kind of dragging.
Right.
Yeah.
And that's not where you want to be. You don't want to
Not
be
at
like
all.
working for the weekend.
And nobody wants to work with that person.
No, exactly. And you don't want to be the person that people don't want to work with.
Right.
Right? Like, you don't want to be the Debbie Downer. You don't want to be the person that people are like,
Yeah.
Kim's here today. All right.
I got you.
I'm going to hang out in my office and stay away from her. Right? Like, you don't want to be that person. So don't be that person. Find what you need to be doing. But also try and bring your best self to work every day too.
Got you. I like that.
Yeah.
I like that. Well, thank you all for your time. Again, this is Dr. Kim Kelly, and my name is Devin Olden, and this has been another episode of Pharmacy IR Podcast.